Truty. I am a primary care physician. I've been in practice for over 17 years now. I've worked in outpatient medicine and back in my career, a little bit of inpatient medicine as well. I now own my own practice here in the Ponte Vedra Beaches area called Balanced Physician Care. So I was asked to talk to a little bit today on what's everybody's mind, right? What's on the top of the mind for all of us and the top of the news. So, I like to frame it as we are in an epic battle. How many of us like, comic books or hero stories and stuff like that, And that's really what this is all about with this coronavirus infection. It's, in the simplest terms, it's the virus versus the host. And that's really what getting healthy and staying healthy is all about. No matter what kind of a cold we have, no matter what type of an infection that we encounter, part of it has to do with the virus itself, but part of it, and that's probably one of the things I want to emphasize, has to do with us and ourselves and what's going on with us and the power that we have as individuals to keep ourselves strong. So the coronavirus, what is it? I mean, I know most of you have probably been listening to the news and watching, and so you probably could tell me a few things, but it's basically an upper respiratory virus. There was many type of coronaviruses out there, for several years. And this particular one emerged in, the end of 2019 in China. Viruses mutate, and this one mutated and became into the form that it has. And it is an upper respiratory type virus, and it's very similar, has a lot of similar properties to SARS, if any of you have read a little bit about that. But basically, this type of an upper respiratory virus spreads by respiratory droplets, okay? That is the main mode of how this spreads. It is the airborne droplets that come from someone who is infected, and maybe they might know it, maybe they might not know it, but if they're infected and they sneeze or they cough, those droplets become airborne. And depending upon where another person is and how close in proximity you are at the moment of whoever that person is, those are all the factors that go into deciding whether you're going to get a big amount of this that you breathe in and affect your system or not. So these respiratory droplets primarily, again, are transmitted through these airborne sort of droplets. Now, do the airborne droplets land on hard surfaces? Yes, they do, and so you've heard about that. And can they last on hard surfaces? Yes, they can. But this virus is very susceptible to plain old soap and water. So any hard surfaces that those droplets fall on, they might survive for up to 3 hours on that surface. But if it's washed with soap and water, that virus is gone and it's neutralized. And the droplets seem to only be able to travel 6 feet. So that's where everybody is getting this 6 feet of social separation, is because if someone coughs or sneezes, they're really only able to transmit those droplets about 6 feet. And we're not really sure how long it stays airborne. Some people say not really very long. Other sources say it could be up to 3 hours. Certainly, if you're in an enclosed room where there's no ventilation, it's going to hang around. If you're outside in the air, the wind is blowing around, there's a lot of air exchange, those droplets are not going to hang out around outside. So those are sort of the characteristics that are the basis for all these recommendations that everybody is having out there. So what are the symptoms? Anybody give me what some of the symptoms are? I'm sure you've heard them all. Yes.
Hard to breathe.
Hard to breathe, right? That's like one of the cardinal symptoms is you have shortness of breath. Anybody else? Fever, right. Fever is the primary symptoms. That's why everybody is checking your temperature, because 99% of people have a fever who have this virus. 99% of people who are exhibiting symptoms. So, but it could be a low-grade fever, and that's the tricky part. A lot of viruses like the flu can typically cause a higher grade fever. This fever could be low, could be 99.7. It could be, barely 100. So that's why sometimes it's hard to feel feverish. So that's why everybody's trying to check temperature. The other cardinal symptom is dry cough. 59% of people have, it's a dry cough. It's not a wet cough. It's not a mucousy bronchial type of a cough. It is a dry cough, and then the shortness of breath. Those are the three cardinal symptoms. Other symptoms can be back pain, muscle aches. And again, this is not like, if you have a bad disc or arthritis pain, this is kind of that vague, achy pain. Nausea and fatigue. 70% of people have fatigue. The important thing about this, though, what we're concerned about is there's some estimates out there that a third of people who may have this virus or get this virus might not feel anything. And that's really what in the community is the biggest concern of all your politicians and all of your infectious disease community and public health people, is that people who might have the virus but really not experience any symptoms and be out, in the community and may cough or sneeze because it's allergy season here in Florida, and then spread that virus. So that's obviously our biggest concern. How long does it take, to get, exhibit symptoms? Typically, for some people, if they might catch it, it could take about 5 days is usually the biggest, on average onset. So from catching it to actually developing symptoms, usually, is about 5 days is what we're looking at, but it possibly could take up to 14 days. And so those are the reasons for the isolation for 14 days. If you come in contact with someone, a family member or a friend who tests positive for the virus, that's why we tell you to go in isolation for 14 days, is because it's possible that it could show up anytime, and it takes about 14 days. But after 14 days, you're clear. So I've told all of my patients, if they call me and they say, hey, Dr. Truty, I was just around, my, daughter who, tested positive, my words of advice are, okay, just stay home for 14 days, keep in touch with me on how you're feeling, and then after 14 days, if you don't exhibit symptoms, you're probably not going to develop this. So those are, some of the reasons. There's two types of way this virus will go. So if you do get it, there are going to be a large number of us, 80% of us, the estimates are, they're just going to have mild symptoms. So that's really good news. I mean, if anything is going to cause a global, pandemic and go around, a virus that 80% of the people are going to have mild symptoms and recover, that's pretty good. That's a pretty good number. But there are 20% of people, and these are what we're trying to as a community help, 20% of people who may develop critical symptoms, end up in the hospital, and end up in the ICU under serious conditions. So there's sort of two trajectories that this virus sort of takes. And the biggest thing that will cue us in on that is, for the ER docs that I know that are, on ground zero working, and seeing this virus, is that shortness of breath. So usually anywhere from 2 to 11 days, but on average about 5 days after exposure, people tend to get these symptoms, and then if you're progressing down a worse path, it's that increased shortness of breath that's going to really clue us in. So, I tell my patients in the community, if you're having some upper respiratory symptoms, it's okay. We're going to watch you, let your doctor know. We're going to monitor you. But if you start having increased shortness of breath, that's where we really need to know, and we're going to check you out and see what your oxygen levels are. That's the cue. The key is that if those oxygen levels are falling, that's really where we're going to get more concerned. And so if those scenarios happen, it's really going to be up to your individual physician to help you decide whether you need to go into a clinic and get evaluated, or if you're going to just be, tested and monitored. So, I want to talk a little bit about, treatment, because I think that's a lot been on the news, I mean, for most of us, because 80% of people are going to do better, treatment a lot of times is just observation. It's just letting the virus run its course like we would with any other cold. But for those of us that are in a vulnerable population, there are some treatments out there. Now, they are not FDA approved yet, but certainly there are some things that are showing promise. And in a time like this, I think most of us as physicians are going to go ahead and move and use these types of treatments, and kind of figure out, later, which are the best ones. So, the biggest one that the president talks about is hydrochloroquine. So have you heard that one? So that one it's a medicine that we already have. Most of may have heard that it's used typically if you have malaria, to prevent malaria if you're traveling, or if you get malaria to treat it, or it's used in rheumatoid arthritis. So this medicine's been around a lot and we know about it. So, if you're vulnerable and you're getting symptoms and we're suspicious, I think, as most of us think, we're going to maybe really consider going ahead and starting you on this medicine. But usually that's only if you're going to be displaying symptoms that are concerning enough, and your physician is going to help you to make that decision, where you're at. But I do want to give you, some feeling that there is stuff out there to help this and to treat this. There's also several other antivirals that are out there as well. Those obviously are newer agents and being looked at and having to put through some more rigorous trials. But the hydrochloroquine is, a very, very positive thing that's out there. I also want to talk about a few things that I've heard out in the media that patients have asked me, questions. If any of you have asthma or COPD or chronic bronchitis, there's a concern about steroid use. Steroids, suppress the immune system. So, if you have chronic steroid needs or use, certainly if you need them to keep your disease under control, you should be taking them, If you need them, we're going to want you to continue to take them. If you have an aerosolized or nebulized steroid, that certainly provides a less risk than an oral steroid. And again, we're going to want you to continue to take that. I've had people ask me whether a nebulizer is okay to use or not. And part of that concern comes from if you're in the hospital and you have the virus, we don't want to give you a nebulizer because that will aerosolize the virus out into the room and then into the other healthcare workers that are taking care of you. But if you are at home and you are, using this in your own setting, don't worry, and you maybe have a little bit of a cold, don't worry about using the neb. It's not going to make the coronavirus, if it is that, any worse. It's not going to cause it to be any worse at all or anything. We want you to use your nebulizers and we want you to use your inhalers if you have those chronic diseases.
How about I take prednisone?
Yes.
Continue with that?
Yes. If you're taking it for a medically needed
Yeah.
reason, we want you to continue to take that. Yes, does it suppress your immune system and make you more vulnerable? Yes, it does. But we believe it's more important to keep whatever, the problem
Yeah.
is, under control first. So that's the theory behind it. Some of you may be on ACE inhibitors. I don't know if you know what those are. Those are things like lisinopril and enalapril. ARBs are like, trying to think of the name right now, but those type of medications, continue to take them for right now. There is some concern about whether the virus, how it works, may be involved with that ACE system, but unless you speak to your doctor and they say differently, I would continue to take that medicine. Now again, it's important to keep your whatever medical problems you have under the best control we can. The anti-inflammatory thing, I know a lot of people have mentioned not to use NSAIDs or anti-inflammatory medicines, so that's like medicines like ibuprofen, Aleve, diclofenac, Celebrex. So, I mean, if you don't have any symptoms, I would continue to use those. We're kind of thinking that might be debunked. That might not really be the case. Certainly if you're sick, I would probably err on using Tylenol for a fever, maybe rather than ibuprofen. But if you are on anti-inflammatories, I right now would not tell you to stop them. So with this virus, who's vulnerable? Who are the people who we're most concerned about? So we're doing all these precautions and we're telling you, you have to stay home, which really, stinks, I know, not to be able to get out and do the things you want to do. But the population that's vulnerable with this virus obviously is not infants and it's not children, it's any adults over 65. That means any adult over 65, is a vulnerable population. So and I know that there are healthy people who are over 65 and there are people who are maybe not so healthy over 65. And there are certainly people who are 55 who are horrible and not healthy at all. But, there's just a concern that as we get older and we've made this arbitrary cutoff of 65, that there seems to be a more vulnerability. And so we want you to be, anyone who's over 65, to be very cautious because prevention, is the best medicine. Yes, we have these treatments, but if we can prevent you from getting it in the first place, that's really, really what's the most important. Other populations besides over 65 is people who have any kind of chronic medical conditions, anyone who has lung disease, anyone who's a smoker, anyone who has diabetes, high blood pressure, or coronary artery disease, or recovering from or have cancer. So, I mean, that's a lot of people, right? I mean, regardless of what your age is, there's a lot of people who have these chronic medical conditions that we have to be concerned about. And so, again, the thing about this virus is that we're not, obviously, if you have symptoms, most of us know we're going to stay home and isolate. But it's the people who don't have the symptoms who might be, have the virus or been exposed to the virus and out in the community shopping, who you're in close contact with, even our loved ones, our friends and our relatives. Those are the people who could spread this to us inadvertently because they don't realize it. I mean, I am a healthcare provider and I am encountering people every day. And, for most of us as healthcare providers, it's a new world. We're doing telehealth medicine now. My practice, Balanced Physician Care, we've been doing phone visits and telehealth medicine for the past 4 years. It's not that new to us, but, we still are seeing patients in the office. And I've had to isolate from my family members because I don't want to give them the virus, as hard as that is. You know, my mom falls into a vulnerable population, and you know, me, my husband, and my son, we don't go to visit her, as hard as that is. You know, we talk on the phone, and we, you know, maybe we'll come by at a distance, but we don't, because we don't want to take that chance. Even though I'm feeling perfectly fine, and all of us are feeling perfectly fine, you know, we having to keep that distance just because we don't want, you know, that to happen. And I know that's a hard thing to talk about, and that's a hard thing to really, you know, really put our handle on, because we're all social human beings, right? We all want to love, you know, be around people. We want to be social. That's just part of our nature as human beings. So I'm kind of going to finish up with leaving, you know, some what I think is sort of the best thing that you can do in the community for yourself, to keep yourself as healthy as you can. You know, saying we're in an epic battle. It's like, you know, the comic book kind of a thing, you know, Batman versus Joker, or, you know, take your pick. You know, and we have on one side we have the bad guy, the virus, and on the other side we have, you know, the good guy, the hero. And so there's two things that, you know, decide whether or not you're going to get sick. One is going to be, yes, your exposure to the virus. But the second thing, and a really important thing, is you as a host. What you can do with your own body and your own body's health to keep you healthy in order to fight this off. Because you might encounter the virus, but if the virus feels that you're, as a host, are a strong host and your immune system can fight it off, then it's not going to settle in and it's not going to cause you a problem. So obviously we've talked about, and I'll just reiterate quickly, you know, what do we do to prevent getting the virus in the first place? Well, obviously the hardest thing, but also the easiest thing, is to isolate, right? If you're nowhere near the virus, you're not going to get it at all. So, you know, that's why the CDC are making these guidelines for isolation. That's why our governor has shut down almost any non-essential business at this point in time, is because if you're not exposed to it, there's no way you're going to get it. And you're not going to overwhelm our emergency rooms and not going to overwhelm the hospitals right now. So that's obviously a really serious thing that we all have to look at doing, as hard as that is. You know, if you're an essential worker, you know, there are guidelines for whether you should go back to work. And I really want to emphasize that if you have a fever, don't not tell anybody. Tell somebody. Tell your doctor, figure out a way to talk to a health professional, because, you know, it's important for someone to know what's going on with you, so you can kind of be watched and monitored what's going on. And if you have a fever, stay home. Even though it's mild, maybe you have allergies, and, you know, it's probably a sinus issue, or it might be, you know, a mild cold and it doesn't feel bad. It doesn't matter. Stay home, because you just don't know. Even though you may never be around, it is out in our community now, and that's my number one thing is we're all in this together. And I'll say that a couple times here as we finish up. We're kind of all in this together. So if you're sick and you stay home, then, you know, we're going to keep it from spreading. You know, going out, yes, you know, I'm sure it drives all of us a little bit crazy to stay around with our confined areas. But, you know, the second thing short of isolation is, if we go out, you know, we got to just be really careful. And why? Is, again, because how this virus spreads, it spreads by the aerosolized particles in the air. So trying to avoid going out is best, but if you go out, you know, trying to make sure that you're doing, you know, all the right things to, when you're coming back, to not bring anything back, you know, with you within the area that you live. Remember, like I said, the particles in the air may aerosolize for only 0 to 3 hours. So if you're going out to a grocery store, or you're going out, try to go when there's not a lot of people as best as you can. I know that's easier said than done, but if you're in a vulnerable population, the less other people are together, the less people are potential for coughing and sneezing and air for you to breathe. So as much as you can, try to go at off hours and off times to avoid that. And I know, and everybody knows, stay 6 feet away. Why? Because of that, the particles can only spread about 6 feet. A lot of people ask me about masks, and this is a difficult thing. I mean, the people who really need the masks right now are going to be the people in the hospitals dealing with people who are sick and have this virus. And to be honest, we have a shortage of masks right now. And so we really need to try to, as much as possible, utilize the masks in those scenarios. The CDC has said, that masks, really don't make much of a difference as far as, passing this on. I mean, I think if you have one at home, and great if you want to wear it, it might help prevent you from touching your nose and your mouth or your eyes. I think that's good, but for most of us, we can just have one mask and spray it down with some Lysol or some bleach solution and use it again. So we can certainly do that, because it's really about us not passing something on to somebody else as well. The ones that are really good are the N95s, and those are the ones that are really going to filter out those particles. And most of us don't, except hospitals who are doing active healthcare with patients with active disease, have those masks. The other thing that you can do besides isolate and is to avoid touching your eyes, nose, and mouth, because again, that's that respiratory droplet spread. If you touch a surface that has the virus and then you touch your mouth, your nose, and your eyes, that could spread it to you. Again, primarily it's in the airborne, but again, these particles can be on hard surfaces. So that's why everybody says to wash hard surfaces as much as you can. Does everybody know what the CDC bleach solution is? The bleach solution the CDC recommends for disinfecting is 1/5 of a cup of bleach to a gallon of water. Okay, you put that together, that is a strong enough solution that you can spray on stuff. And I sprayed all over my house, and it really hasn't bleached any of my furniture or anything like that. So it's a good disinfectant. There's a whole list of other products. Yes, Clorox wipes are some. You can we have my business cards here. If you want a list, the CDC has a website, and they actually have a list on their website of approved cleaning products. We can email you that list if you want it. Wash just anything everybody else touches. So, if someone else comes into your area or your place, when they leave, just spray off anything that they may have touched. It's just an extra precaution, so that, you're not touching anything and then touching your eyes and the mouth. This is not a bloodborne illness. This is not a foodborne illness. So you don't need to walk around with gloves, and you don't need to worry about, your food that you eat or anything like that, who may be handling it, because it's not that type of an illness. So the last thing that I want to just emphasize is, what can you do as, as a person in your own body to help, protect you. To me, this is the critical thing. I mean, as a primary care provider, as a person who believes in prevention, I think an ounce of prevention is worth a pound of cure. If you have seasonal allergies or sinus issues, make sure you have that under control. Make sure that I'm a real big believer in the saline nasal sprays and the sinus rinses that you can get. use that. Make sure if you're using a sinus rinse, you use boiled or distilled water, and spray that into your nose. That has been shown in medicine to help decrease the ability of these viruses to stick on the mucus and the particles in your nose. So, do that. Make sure your allergies under control. Whether you use herbs, there's some great herbs that can be helpful to prevent allergies. Some of them are quercetin, stinging nettle. Those are herbs. We have, something called D-Hist in our office, which is a herbal combination that helps with allergies. But, Flonase, Nasacort, Zyrtec, Montelukast, or Singulair, make sure that your allergies are under control. So if you're using one of those and you're still getting the sniffles, you're still getting nasal congestion from allergies, talk to your doctor about using a second one. We can layer them on top of that. Because when your immune system's fighting off allergies, it's more vulnerable to catching the virus. So to me, around here in this area, that's really important, easy step all of us can do. The second thing is eat healthy. I know this sounds trite, but your fruits and your vegetables are really important. They keep your immune system going. And when we're stressed and we're anxious about what's going on out there, we're not going to want to eat the fruit and vegetables. We're going to want to eat the sugar and the fats and the comforting food, that makes us feel better emotionally. So try to, as much as you can, eat healthy, make sure you're getting your oranges and your citrus and your grapefruit and your lemons and your limes. Those are all rich in vitamin C. Take the time to exercise. That's going to help keep your immune system strong. If you can't, if you can walk, that's great. If you can move around, that's great. Maybe do some chair Tai Chi. If anybody can, has access to, the internet and YouTube, you can just YouTube chair Tai Chi, and that's just a great way if you can't move around very well, to stay active. So I would recommend that as well. Make sure you're getting sleep. Make sure you're getting sleep and try to stay calm. I think it's an anxious time, and there's a lot of things on the news